It's Wednesday, November 20th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, as well as an in-depth look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, offering a Medicare buy-in option for middle-aged Americans could have costly repercussions.
Prolonged headaches could be a lasting effect after a child's concussion.
Aspirin's days may be numbered in heart attack patients after PCI.
And the public's support for medical marijuana crosses the political aisle.
Plus, why the onset of menopause is a prime opportunity to take action and reduce a woman's health risks. But first, thanks to all of you who've helped us make this podcast better by taking our short listener survey. If you haven't, please take a moment to complete the survey by following the link in the show notes. And now, the news.
Allowing people aged 50 to 64 to buy into Medicare could push premiums higher for people who purchase health insurance from ACA marketplace plans. It's a finding that runs counter to many people's expectations. In a new report, researchers at the RAND Corporation looked at the potential impact of a Medicare buy-in option. It's a proposal supported by Democratic lawmakers and several presidential candidates. The RAND researchers estimate the premium for so-called bronze plans in the ACA marketplace might increase by 2% to 10%, depending on the design of a Medicare buy-in program. What's behind the surprising finding? There's a perception that younger adults have in effect subsidized the cost of older ones in the marketplace plans. Instead, it appears that younger adults who enroll in the individual market tend to be relatively unhealthy and thus expensive to cover. If older adults left for a Medicare buy-in program, insurers would be left with a smaller pool of younger, less healthy, and relatively expensive people, and that could lead to higher premiums.
Children and teens without a history of headaches may develop prolonged headaches after sustaining a concussion, and those who do should be evaluated and treated by a neurologist. That's according to Cleveland Clinic researchers who presented a study on concussion at the annual meeting of the Child Neurology Society. Those post-concussion headaches can include migraine, chronic daily headache, tension-type headache, or a combination of such headaches. The CDC estimates that up to 3.8 million concussions occur annually during athletic and recreational activities in the U.S. About 90% of those concussions affect children or adolescents, and the symptom most often reported after concussion is headache. The investigators analyzed data from 69 pediatric patients diagnosed with concussion who had headaches for longer than 2 months after injury. 78% of patients continued to have headaches after several months despite treatment. 75% had migraines, while 94% had chronic daily headache or tension-type headache. 70% reported having 2 types of headache. Long-term, most patients reported that their emotional, cognitive, sleep, and somatic post-concussion symptoms had resolved, but a majority of the study's participants still had headaches.
And downshifting to ticagrelor monotherapy after just 3 months of dual antiplatelet therapy with aspirin is a winning strategy in high-risk patients who have undergone PCI for non-ST elevation acute coronary syndrome. That's the key finding from a subgroup analysis of the TWILIGHT study. Researchers from the Icahn School of Medicine at Mount Sinai in New York reported the results at the American Heart Association Scientific Sessions in Philadelphia. Post-ACS patients who had undergone PCI completed 3 months of dual antiplatelet therapy with ticagrelor and aspirin. Then they were randomized to 12 months of dual therapy or to ticagrelor plus placebo. After a year, ticagrelor monotherapy cut the risk of clinically significant or major bleeding by 53% compared with dual therapy. And monotherapy came with no increased risk of ischemic major adverse cardiovascular events. The Daily Medical News will be right back after this.
There may not be much common ground between Republicans and Democrats these days, But both sides strongly supported the use of medical marijuana in a survey by the American Society of Clinical Oncology. Overall support of medical marijuana among more than 4,000 respondents was higher for use among cancer patients at 84%. But 76% of people also supported its use for any medical reason. The differences in support between Republicans and Democrats were significant, but levels of support among both parties were greater than 80% for marijuana use by cancer patients, and they were greater than 70% for use at any medical reason. In both cases, the independents in between mirrored the overall population, with support at 84% and 76% respectively.
And finally today, postmenopausal women are at risk for numerous medical conditions after the onset of menopause. And that makes the onset of menopause a major opportunity to identify risks and start preventative strategies. Dr. Rogerio Lobo is professor of obstetrics and gynecology at Columbia University in New York. Speaking at the annual meeting of the American Society for Reproductive Medicine, Dr. Lobo outlined the postmenopausal health risks. Specifically, newly menopausal women are at risk for diseases across multiple specialty areas. Those include obesity, metabolic syndrome, diabetes, cardiovascular disease, osteoporosis, chronic arthritis, dementia, cognitive decline, depression, and cancer. Dr. Lobo says his focus in these patients is on longevity, reducing mortality risk, and improving quality of life. Conflicting findings in the Women's Health Initiative and other studies have created confusion about estrogen therapy's benefits and harms for postmenopausal women. Dr. Lobo says some of conflicting findings may be explained by the timing of hormone therapy. In the ELITE trial, for example, estrogen therapy helped prevent progression of subclinical atherosclerosis when therapy was initiated in early, but not in late menopause. Estrogen also has benefits for the brain, Dr. Lobo adds. It might help improve rates of cognitive decline and Alzheimer's disease in postmenopausal women. In the Cache County study, for instance, use of hormone therapy within 5 years of menopause was associated with a 30% reduced risk of Alzheimer's. Dr. Lobo encourages clinicians to look at hormone therapy's risks in terms of absolute risk rather than relative risk. In WHI, he explains, many of the negative events weren't statistically significant, but even if you assumed that they were, the absolute numbers were 7 to 8 events per 10,000 women per year. For more of Dr. Lobo's perspectives, click the link in the podcast notes. And that's it for today's daily medical news. Be sure to check out the newest episode of the MD Edge Psychcast. Psychcast has new episodes dropping this Wednesday and every Wednesday. For MD Edge, I'm Nick Andrews.
And I'm Molly Colegio. Thanks for listening, and we'll see you tomorrow.